was your journey to becoming a genetic counselor?
Hi, my name is Nate Conley. I'm a certified genetic counselor with Rader Hospital in the Medical College of Wisconsin. My journey to becoming a genetic counselor is when I went to my undergraduate institution, I went in pretty convinced I was going to be a physical therapist. So I was really prepared for that type of training. But as I got more experience within that field, I came to the realization that physical therapy wasn't really my passion. So I started exploring other options like getting a PhD, and I eventually landed on going to genetic counseling school. So I really spent the rest of my undergraduate time exploring that and getting prepared for that application process, which included, getting connected with different types of genetic counselors, getting different counseling and advocacy experience to make sure that I was as prepared as possible going into the application cycle. So I graduated from the University of Wisconsin La Crosse in 2019 with a major in biology and a minor in sociology. And from there, I went straight into my graduate program. So I went to the University of Cincinnati and Cincinnati Children's Hospital Genetic Counseling Program, where I graduated in 2021.
How did you choose your genetic counseling specialty?
Right now, my current genetic counseling specialties are hereditary cancer and hereditary neurological diseases. So, when it comes to hereditary cancer, there is often quite a lot of structure in terms of what types of genetic tests to offer, when to offer testing, and then a lot of really clear recommendations in terms of screening if somebody ends up coming back positive. So there's a lot of guidance that exists within that specialty. When it comes to hereditary neurological disease, especially within the adult population, it's quite a bit different from hereditary cancer. So there's not necessarily those guidelines in place. You're often having to do deeper dives into the research literature, kind of make your own genetic panels, get in contact with other genetic counselors around the country to see what they're doing with certain types of indications. So it's just a much different type of toolkit with each specialty. So I was really intentional about choosing those specialties because there's that balance there between things that can seem more kind of straightforward versus maybe more complex cases where you have to do a little bit more legwork.
What does your typical workday look like?
My schedule rarely varies day by day, depending on what specialty I'm working in. I would say on a typical day where I'm seeing patients, I'll see anywhere from 1 to 4 patients, depending on their complexity. And on those days, what I do is I spend a lot of time reviewing that patient's medical records, making sure that I really understand why that patient was referred to me, what their concerns are, what their provider's concerns are, to make sure that I'm as prepared as possible for that upcoming appointment. If necessary, I also spend time reviewing the literature, so diving into different types of research papers, especially if it's a type of disorder or condition that I haven't seen before, making sure I have all of the information to be able to educate the patient as well. And then my patient appointments typically take anywhere between 45 minutes to an hour usually. And once I'm done meeting with the patient, I spend time documenting into their medical record what our conversation was and what our next steps and plan is. And if I have time at the end of the day, sometimes I'll be placing genetic testing orders, making sure that all of those patients that I've seen have all of their kind of follow up tasks taken care of. On days where I don't see patients, it can really depend what I'm doing. So sometimes I will be giving lectures to our genetic counseling graduate students. We have a prospective student program at the Medical College of Wisconsin. So sometimes I'll be helping and facilitating those discussions. And other times it's just catching up on certain types of administrative tasks like finishing any patient documentation, talking to any providers if it's necessary, doing research. Those administrative days are really whatever I want to make it. So, a lot of different types of tasks get done during those days.
What is the most challenging aspect of being a genetic counselor?
So there can be multiple challenging aspects to being a genetic counselor. I think some of the hardest aspects is that our work is never really done. We always have this to-do list that we need to get through in terms of, patient follow-up, writing letters, contacting providers. So I think sometimes genetic counselors, especially when they're just graduated, entering the field, can really feel pressure in having a hard time creating boundaries for making sure that you're just working within work hours, you're not overextending yourself. So I think that can be a really challenging aspect of the genetic counseling role. I also think that there can be challenges in terms of relationships with other providers. So sometimes not everyone believes in the utility of a genetic counselor. So you really have to advocate for yourself and advocate for the profession to show where your value is to a practice or to a patient population.
What do you like most about being a genetic counselor?
One of the things that I like most about being a genetic counselor is that our field is constantly evolving. So, as I mentioned earlier, I just graduated from my program in 2021. So, fairly recently. And some of the things that I learned in my graduate program are already outdated. So, it's really fun and really exciting to be able to keep up with all these different kind of research advances, seeing how philosophies and paradigms change with genetic testing and genetic counseling. So that's a really fun part of being a part of this profession. Another aspect that I really like is just being an educator for patients. Oftentimes, in other types of doctor's visits, they may only spend, 10, 15 minutes in the room with the patient. Whereas with genetic counseling, you're really spending, 30 minutes, 40 minutes, sometimes an hour plus with patients, really talking through what is genetics, how does genetics play into their picture, and what can genetics do for them. So I really like having that kind of comprehensive educator role for patients and making sure that they can make informed decisions about their healthcare.
What advice do you have for aspiring genetic counselors?
For aspiring genetic counselors, I would recommend just pursuing different types of experiences, pursuing where your passions lie. So, getting in contact with genetic counselors that are in specialties that you're interested in, seeing if you can get any shadowing exposure, and then making sure that you're getting different types of counseling and advocacy experiences in causes that you yourself are passionate about and that you want to explore. I definitely advise that folks pursue those passions rather than just trying to check a box on the application. I think those experiences are good opportunities to see, is this field really a good fit for you? Are you utilizing your skills in the way that you want to? so that you're as prepared as possible going into the genetic counseling field. Genetic counseling graduate programs are very time intensive. They're a financial investment, and they can be quite demanding because they're so accelerated. So making sure that you have all of those experiences and that you feel confident in the decision to pursue genetic counseling. I would also recommend that you have these experiences to create the most well rounded application process so that when others are reviewing that application, they have an understanding of why you want to pursue genetic counseling and why this is a good fit for you. So, those would be my main pieces of advice for aspiring genetic counselors.